All right, so we all know that our heritage plays a big role in our health, right? Well, today, genetic counselor Devin Fendlay from Women's Care Florida is back to tell us about hereditary cancer syndromes that we should know about. There's lots to discuss here. In fact, so much we're going to actually we already know you're coming back to even dive more into this. But good morning. How are you?
I'm well. How about you?
Good, good. I think this is so important that we talk about this because I feel like we are hearing this more where, you can find out about your genetics. Mm-hmm. But what should we be looking for?
Yeah, so, there's a lot of different hereditary cancer syndromes out there. Right now, one of the major ones people are talking about is hereditary breast and ovarian cancer syndrome related to the BRCA1 and BRCA2 genes.
Okay.
One of the reasons people talk about those the most is it's the most common hereditary cause of breast cancer.
Okay.
So about half of people with a hereditary breast cancer predisposition have a change in one of those two genes.
So do you and your team really suggest that if there's any history whatsoever, or, how do you know when you should find out if something, if that's hereditary in your...
Yeah, so there's a lot of different factors to go into that, but some of the red flags we look for in families are early cases of breast cancer, especially under the age of 50.
Okay.
If there are 2 breast cancers in the family, one was very young, 3 breast cancers at any age, certain ancestry like Jewish ancestry, higher chance to test positive, any ovarian, pancreatic cancer, are just some of the red flags that we look for.
Well, and it's interesting because I have a family history of ovarian cancer, so I recently had to go through this as well. Are they all related? How do you kind of best describe what you're looking for and what you need to be concerned about?
Yeah, so they can be linked. So when we're talking about BRCA1 and BRCA2, we know there's a clear link with breast and ovarian cancer. So I want to start by kind of clarifying one of the misconceptions you have about these genes.
Okay.
So a lot of people tell me she has the breast cancer gene, she has the BRCA gene, but it's not quite correct. So we all have these genes. We all have the same exact set of genes, and they play a very important role in our body.
Okay.
So the BRCA1, BRCA2 genes are actually the good guys. They protect us from cancer. When someone has a positive genetic test, what it actually means is they have what we call a mutation. There's a spelling mistake in that gene that you were born with that makes it not work properly. So it's not doing its appropriate job in protecting you from cancer. And we know that with BRCA1 and BRCA2, if you have one not working, it can cause a risk for breast and ovarian cancer, both of them, as well as pancreatic cancer, prostate cancer in men, and melanoma skin cancer.
And what are the chances? Because because you find out that you may have that, is it immediate panic mode at that point? I'd imagine there's a lot that you then have to consider and look at. But how serious is it?
So it is pretty serious. These risks are high. The risk for breast cancer with BRCA1 and BRCA2 can be as high as 60 to 70% or even higher in some families.
That you will eventually get it?
Correct.
Okay.
The risk for ovarian cancer can be as high as 40 to 60%, depending on which of the genes. The other cancers are not quite as high, but still very important. So it does cause some anxiety when you get a result like this. However, the goal is to be preventative and proactive. So if we know someone has this, we're going to be doing more breast cancer screenings. Even more than just mammogram. We do breast MRIs.
Well, and even with ovarian cancer, from what, just my family's experience, the sooner you catch it, the better. So if you know that you have to be watching it that much more closely, that's a good thing.
Exactly. The goal is to be proactive. Breast cancer screening's great. Ovarian cancer screening's not as great. And so if someone has a BRCA mutation, we actually recommend that between certain ages, depending on the gene, they actually have surgery to have their ovaries removed just to make sure that that doesn't present.
And then do you need a recommendation? How can we find out if someone's watching today going, you know what, I do want to make sure and find out more? What do you do? What are the steps to have that done?
So definitely talk to your healthcare provider.
Okay.
We've talked a little bit about direct-to-consumer testing. I would say if you're concerned, if you have family history, definitely don't go that route. Definitely talk to your doctor about getting this type of clinical testing. And they can either refer you to a genetic counselor like myself, or they may be able to order that for you. But definitely start talking to your healthcare provider, bring up the family history, say that you're interested in genetic testing.
Well, and I don't know if there's anything else to add to it, but what is your take home? Because again, I think this is such an important, issue for people to bring up with their doctors. What's your take home?
Yeah, I think if you're concerned, if you don't have a family history, just bring it up. There's no harm in talking to your doctor about it. They can let you know, based on your family history, yes, I'm concerned, or no, actually, I'm not concerned with this history.
And
so
I know
bring it up.
Insurance sometimes covers this as well, which I think is good to know. So.
Absolutely. If you meet certain criteria, certain family history, most insurances are covering this. Even if not, there are many affordable options.
Okay, good to know. Always so nice to visit with you. Thank you for your time this morning. We, of course, will put more details on our website, but there is the website to get a hold of their team as well.